Dr. Blake Staker with Westside-Medical. Today we're going to cover the reverse hyper here, designed by Louis Simmons. We're going to go into detail about how it's different from like a standard hyperextension or like a Roman chair. First off, I'll demonstrate what the exercise actually looks like. So you have your patient up here. You want like the table here right where the femur head or the IS joint position there. So you have them up here. Make sure they contract the lats, abdominal brace, and this is a motion right through here. Just like that. So that's different from a standard hyperextension is you get the posterior rotation of the hips. And why this is important is if you look at the lumbar anatomy, you have a curvature right here, and the anterior discs here, the L5S1 and the L405, actually are wedge-shaped, with the front of the vertebra, or front of the disc, being larger than the back. And so if you want to get that real traction in the low back, you want that posterior rotation to distract out that lumbar spine. So this also is very effective for distracting the low back. Also, if you look at the patient placement, you have a patient that lays face down in this position, and this stays stationary versus like a Roman chair or a regular hyperextension. The back is moving with the exercise. This position here, it allows the anti-gravity tissues, any like a disc or a facet or a muscle that's injured, it allows it to be totally relaxed in this position. And also with the discs, this is the lowest interdisc pressure position that there is. So first you have the laying down position, then the standing, and then the sitting. So it only makes sense to have the patient start in a position where the disc pressure is the least. You have the lowest working interdisc pressure. And so when they go through this range of motion, you get that posterior hip rotation, and then it comes back up, and that motion there actually causes an increase in the interdisc pressure, so it causes actual pumping motion in the discs, and that's what brings in the oxygen nutrition that helps to heal it up. So for more on the reverse hyper, check out westside-medical.com.